Hi, everyone. I'm Dr. Ken Brown, board-certified gastroenterologist with Digestive Health Associates of Texas, joined by my colleague and respected partner.
I'm Dr. Stuart Akerman, also a board-certified gastroenterologist with Digestive Health Associates of Texas.
Dr. Akerman and I got to talking, and we realized that during these very difficult times that we're all going through, there's a lot of misinformation out there, and as gastroenterologists, we want to make sure that nobody panics during this period where we're all trying to make sure that we control this COVID-19. So, Dr. Akerman, would you please explain what our office is doing to make sure that we're part of the solution?
So it's a great point. The local conversation is similar to the national conversation, and there's a lot of anxiety around store closings and inability to get just tools of daily living at a reasonable price with an easy amount of effort. And as part of that conversation, it's gotten to the point where even ourselves as physicians have to find closures in our office and cancellations and procedures. And patients who are sick and not doing well, they get worried that they're not going to be able to get the care that they need and deserve while these other issues are going on at the same time.
Exactly. So we have had a lot of people contact my office, and they're very concerned because they're having issues. In fact, we know that anxiety in itself, the anxiety over what we're all going through right now as a world, can actually affect your gastrointestinal tract, and we're fully aware of that. So what Dr. Akerman and I were talking about is that him and I both have some experience doing something that we still want to make sure that you have access to your doctor. Before we jump into that, why don't you explain what our new, basically what the rules we're trying to follow to protect everyone right now with the office and with our procedure schedule?
So we're in line with the national guidelines, which do evolve pretty much on a daily basis at this point. And as such, we've had to significantly restrict the number of patients that we're bringing into the office, rescheduling patients that may not have acute symptoms to come maybe in 2, 3, 4 weeks when we're past, hopefully, the brunt of this acute illness. And elective procedures as of the end of this week will have to be rescheduled and shifted down the line. And these are decisions that were not made lightly, but are done for the benefit of public health.
So we're fully in line with other businesses and institutions that will be affected tremendously. I mean, at least here in our city, in the Plano-Frisco area, Plano-Frisco-Richardson, Dallas area, there are lots of restaurants that are shutting down, making sure that there's no gatherings more than a certain amount of people. Well, we have that same obligation. So unfortunately, if you were set up for a screening colonoscopy, we would like you to be accommodating to the fact that I think that if we can just move this out a few weeks, we can get everybody handled then. But that doesn't mean that you're not going to have access to your doctor. If you are having any type of alarm symptoms, if you're hurting, if you're bleeding, things like that, we want to change how we're going to set up our practice to make sure that you have access. Dr. Akerman, why don't you explain what we're trying to do here?
Yeah, I would echo those sentiments. I think one of the most important points that we need to make is we're only rescheduling at this moment elective procedures and elective visits. Another way to say that is if you're going to feel the same now as you do in a month and you're coming to see us for some sort of preventive care, we'll go ahead and hold off and we'll do that a little bit later. But that's not to say that if someone is not doing well now, that we're not going to give that our utmost attention and try to treat that and address it now.
Absolutely. And what we're going to do here is walk through very quickly something that both you and I have been doing now for over a year, which is telemedicine. You've been hearing this. The president made a speech today describing how we should start moving towards more of a telemedicine practice. Fortunately, you and I have already have a structure in place that is easy to do, and we've been doing it for well over a year, and our patients really do love this. And so we want to make sure that even if it's a question, even if it would be a standard visit, that we're going to be able to help you without being in crowds.
Right, and that's a great point. We're lucky enough to be in a position where we're already established in this arena, and we're sort of at the forefront of the game as it is. We have had established telemedicine care within our practice to some degree, partially as a convenience for certain patients, sometimes to help patients who live quite a distance from our office. in order to get the care that they need that they might not be able to get locally. And for us, this is just an expansion of a culture that we've already established. I think one of the most important things that I've noticed with my patients, and I'll agree with you, the patients who do it love it. I have patients who will sometimes punctuate longer visits with shorter check-in visits via virtual medicine and find that their chronic care improves because of these sort of touch points that they've had along the way. We're going to shift our paradigm a little bit now because patients who maybe are not used to that will be using that in the short term, and even sometimes patients we haven't seen before, in order to get the care that they need now rather than having to wait till some unknown time in the future.
100%. We want to make sure that people are not ignoring symptoms. So it turns out that you actually need acute care at a hospital. Our job is to try and prevent that. We're going to be able to do the usual things we can do except lay our hands on you. We're going to be able to send prescriptions. We can hear that. So if you're in tremendous amount of pain, we're going to be able to order x-rays. Our job is to make sure that you still remain healthy, and we're trying to keep the resources and the burden that's happening at hospitals down. I had a patient today who unfortunately couldn't get into her doctors, and she had to go to the ER, which she admittedly said was not necessarily an ER visit, but I couldn't get in to see anybody else.
Right, and we want to try to decrease the burden on the ERs currently, let them focus on everything they need with the respiratory patients, and try to keep what can stay outside to decrease the overall burden in our ERs.
Yeah, absolutely. And one other reiteration, please. This is not a time to panic, but we all have to do our part, and this is our part. So if everybody has one of these, a phone, they have an option to do a telemedicine visit, don't they?
Yeah, it's pretty simple. It doesn't get much easier than that. I think one of the concerns that I've heard from patients is that they're worried that they're not technologically savvy, they're too old, they're too young, they don't have the right phone. It actually couldn't be easier. And one thing I will throw out there, our staff is here to help you. If for some reason you can't get in touch with us or you can't connect, our staff is available. They'll help you figure it out so that you could get the visit done. We've partnered with a platform that couldn't make it easier for our patients. Essentially, we will send you a text message or an email invite, depending on whether or not you're using.
Let's back it up one step.
Sure.
So how will they actually make the appointment? So will they go to StuartAkermanMD.com?
Yeah, so patients who are interested in appointments with my office just have to go to my website at StuartAkermanMD.com. There's a link right at the top for virtual visits. We'll give you all the information you need, and you can just send us a message on the appointments tab, and one of my staff members will call you right back.
Would you spell that, please, so that everybody can write this down?
Sure, it's StuartAkermanMD.com.
Okay, so that's for Dr. Akerman. All of my patients and anybody that would like to see me, just go to KennethBrownMD.com. KennethBrownMD.com. At that point, you'll be able to make a request for an appointment. We have been working with our staff. They understand that one of the things that we're doing that's kind of exciting is that we're going to let our staff work from home to set this up. So they'll be able to schedule. We'll be able to keep everybody in the with some social distancing, and then we'll be able to continue to have these appointments. It doesn't get any easier. You do that, then the next thing is how do they connect with you then?
So we'll basically be set up with a time slot just like you would with a traditional visit, and you don't have to do anything other than make sure you've restarted your device, it's sort of clean and ready to go, you're in an area that's quiet, has some amount of privacy as much as possible, and has a good Wi-Fi signal. We really would prefer if you've got Wi-Fi rather than just a cellular signal. It tends to be stronger for streaming.
Yeah. For telemedicine records, something that helps out a whole lot, if you could check your pulse, and even if you could check your blood pressure, if that's capable, then we can certainly put in some vitals as well. I was having my patients do that for me, and then I can count respiratory rates and do things just so that we can keep an eye on them and still use what we can that we can visually see. Right,
and one of the important points to remember, it's still a visit just like any other. So come prepared with your questions, know what it is that you want to get across. We're here to help you and to try to make you navigate this easier and make the whole process not necessarily enjoyable because we know that you're not feeling well, but much more efficient and complete.
And I'll just reiterate one more time that if it is something that we believe that, you know what, I really do need to lay hands on you, you are going to come into the office. We just want to make sure that the appropriate people do so that we minimize the traffic that's actually going on.
Right. And the platform that we've been using most recently could not be easier. Essentially, we just send a text message to you, and you click on that link. The link opens up the video, and you're seeing our smiling faces right there, ready to go.
Yeah. So don't worry. We're all going to get through this. Dr. Akerman and myself, Dr. Kenneth Brown, are here to make sure that you still have access to board-certified gastroenterologists. We both have done this before, and I think that during this period, I'm very happy that you convinced me to try some telemedicine about a year ago so that we're familiar with all this.
Yeah, and I would, again, reiterate that, like Dr. Brown said, we're here to help. And this is going to be a tough time for everyone, but whatever we can do to try to mitigate that and help our patients and future patients through this hard time, we're here to help out with.
Absolutely. All right, so hopefully if we all work together, we're going to be through this pandemic fairly quickly, hopefully fairly unscathed, but we're all trying to do our part, and I want to thank you so much for taking the time to watch this. Please, if you're having any gastrointestinal issues, I do want to point out that my colleague sitting in front of me happens to be a very super specialist, and you do a couple of unique things that very few people in the city do. So the reason why, well, number one, Dr. Ackerman's here because he's the other doctor in my office that does telemedicine. But number two, he's one of the few doctors in the city that handles some very distinct type of problems. Could you just tell everybody real quick?
Sure. So part of my practice is based in what's called advanced endoscopy. Two big procedures that are involved in that are procedures related both to the pancreas and the bile ducts. So at any time during this transition period, if there are patients that develop yellow eyes, yellow skin, jaundice, severe abdominal pain, unfortunately, cancer doesn't take a break. I mean, patients who may get radiology studies that are concerning for tumors within the abdomen during this time, we're still working. We're still able to see those patients, get them scheduled, get diagnoses, get treatments underway.
Yeah, absolutely. So we've got you covered. I particularly really like to treat irritable bowel syndrome, inflammatory bowel disease, and both of us rather enjoy treating hemorrhoids. So
Yes.
if you've got issues like that, we can help you.
Well,
anything else to add there, Dr. Akerman?
I think that's about it. Again, if patients want to get in touch with us, they can either get in touch with us directly through our websites. They can also call our office. The numbers still work. It's 972-867-0019. And you can just click through the tree for either Dr. Brown or myself, and our schedulers will get back to you in pretty short order.
And keep this in mind. All health begins and ends in the gut. You need a healthy gut to have a healthy immune system. We want to make sure that that takes place. Take care, everyone.